Before taking the medication, please take the following points into consideration. Wash your hands thoroughly before preparing the medication. If the medication is in the fridge, take it out 5 minutes beforehand to allow it to reach room temperature. Try to take the medication at around the same time of the day, choosing a different area of the abdomen each day to avoid irritation. Around the injection site, you may experience a local reaction, and one or more of the following symptoms may appear: redness, pain, swelling, irritation, or bruising. These are normal and disappear after a few hours. Once you have finished, place the remaining items in a suitable container or bring them to your nearest IVI clinic. Find a quiet place and get the materials you need for the injection ready, placing them on a clean surface. The box of GONAL contains 15 disposable syringes graduated in international units, 1 vial of powder, 1 syringe pre-filled with solvent. At your pharmacy, buy alcohol, gauze. Use a suitable container for disposing of these materials after use, or bring them to your nearest IVI clinic. Pay close attention to the following instructions and do not hesitate to get in touch with your IVI centre if you have any questions. Open the box and remove the contents. Open the seal. Take the purple plastic cap off the vial of powder. Take the cover off the syringe containing the solvent. Place the vial of powder on the table. Take the syringe filled with solvent and pierce the centre of the rubber stopper with the needle, pushing it in as far as it will go. Next, press the plunger down, slowly adding all of the solvent to one side of the vial to prevent bubbles from forming. The powder will dissolve quickly, forming a clear solution. You will notice that when you release the plunger, the syringe springs back, leaving a little air. Don't worry, it is the pressure generated in the vial that causes the plunger to rise. Remove the syringe with the needle from the vial. Mix the contents of the vial by swirling gently with your hand, taking care not to shake too roughly. You should only use the disposable syringes included in the box of medication. Take one of these, remove the wrapping, and pull off the cover. Pierce the centre of the rubber stopper of the vial with the needle, pushing it in as far as it will go. Hold the vial upside down and draw out the prescribed dose by pulling back the plunger. If you withdraw more than the prescribed amount, depress the plunger until you have the correct dose. If any air gets into the syringe, pull back the plunger and tap the syringe gently until the air rises to the top. Press the plunger in again until you have the prescribed dose. Take some gauze soaked in alcohol and thoroughly clean an area of your abdomen below the level of your navel. With one hand, pinch a fold of skin and insert the entire length of the needle with the bevel facing up at an angle of 45 to 90 degrees. Depress the plunger slowly and steadily as far as it will go. Next, let go of your skin and pull the needle out gently. Press down on the area for a couple of seconds with the gauze while massaging it lightly so that the solution disperses under the skin. Finally, put the cover back on the needle. Dispose of the syringe in a suitable container or bring it to your nearest IVI clinic. To store the medication correctly, please heed the following advice. Keep it in its original packaging to protect it from light. Store below 25 degrees centigrade. After use, keep the medication in its original packaging until its next use.